All right, party people, we are back at it with another one. Let's get it. So, if I was to give you a 50-year-old dude with a neck mass, when asked, he tells you that the mass is painless, but it's been disappearing and reappearing for a couple of years now. It comes for a couple of weeks, then goes away after a couple of weeks. On biopsy, the DNA does not form ladders of regularly shaped bands when treated with agents that increase caspases. This presentation is due to increased expression of which of the following? Please make your selection. 3, 2, 1. Boom. There it is. Let's get into why the correct answer was correct and the incorrect answers are incorrect. So first and foremost, this patient's presentation of the waxing and waning painless neck mass refers to follicular lymphoma. It's the most common indolent non-Hodgkin's lymphoma and typically presents with a painless mass that increases and decreases in size before it transforms into a more aggressive form. This often resembles diffuse large B-cell lymphoma. Diffuse large B-cell lymphoma is the most common aggressive non-Hodgkin's lymphoma. Again, this is follicular lymphoma. The waxing and waning painless neck mass should be enough for you to answer that aspect of the question. Now let's break that down. Even if you didn't immediately know or recognize the clinical picture, the question continues to reference ladders of regularly shaped bands. This sounds weird, but it's actually high yield for apoptosis. They also mention caspases. Caspases are important enzymes involved in activating apoptosis. The key point here is that the cells in follicular lymphoma are not undergoing apoptosis, even when treated with agents that normally induce caspase activity. This is why you don't see those quote-unquote ladders. It's a sign of impaired apoptosis. Although this might sound weird or, esoteric, it is tested on USMLE step 1. Key points that you have to remember for this question. BCL2 is the gene involved in follicular lymphoma. It's an anti-apoptotic protein. The associated translocation is 1418. Don't mess this up with MYC, MYC, as in c-MYC, which is associated with Burkitt lymphoma. This is a translocation of 814. It can also be associated with a translocation of 2 to 8 or a translocation of 822. MYC is a transcription factor. So again, BCL2 is anti-apoptotic, follicular lymphoma, translocation 1418. MYC, MYC, is transcription factor. It's associated with Burkitt lymphoma and associated with translocation 814 or 28 or 822. Now, histology isn't necessary for follicular lymphoma, but it is for Burkitt lymphoma. This is the one that they'll hit you with where they'll show you the quote-unquote starry sky. This is classic. It shows a background of lymphocytes with interspersed macrophages undergoing apoptosis. They could show you a histo slide and point to one of those macrophages and ask what is going on there. And the correct answer would be apoptosis. So other translocations that you need to know for BCR, ABL, this is the Philadelphia chromosome, translocation 922, seen in chronic myelogenous leukemia, CML. This creates oncogenic tyrosine kinase and is treated with imatinib. The side effect of imatinib is fluid retention. For CCND1, this gene encodes cyclin D1. It's associated with mantle cell lymphoma, which is a translocation of 1114. Not commonly tested, but that's more or less what you need to know for it. For EWSR1-FLI1, this is seen in Ewing sarcoma. This is a translocation of 1122. What you'll see is pediatric bone tumors affecting the diaphysis of long bones, which can mimic osteomyelitis. Classic histology includes onion skinning and small blue cells. Do not mix up Ewing sarcoma for DeGeorge syndrome. Ewing sarcoma is a translocation of 1122. DeGeorge syndrome is 22q11 deletion. They are completely different and separate entities. In summary, when you see the waxing and waning of a painless lymph node mass, just understand that you're being presented follicular lymphoma. This is associated with BCL2, which is an anti-apoptotic protein, and associated with the translocation 1418. All right, that's it for this one. Go crush it.